Senator, I don't know if you had an opportunity to hear what we were talking about just before you came on.
Yes.
You are a doctor, so I imagine you will care about this. The idea of Warren Buffett, Jeff Bezos, and Jamie Dimon getting together to create what looks like a joint venture potential. I don't know if we're saying it's a not-for-profit. We don't know about that.
It is
It is a not-for-profit to effectively try to streamline and reduce costs in healthcare. Talking about a private sector approach. What do you make of that?
Well, I like it. I've always felt that private sector can do a much better job than government in terms of allocating resources, helping people come up with the right solutions for things without a lot of the waste. And those are the right three people to do it. I know that Becky, you visited with some of them this weekend. I think you did as well. Andrew, they were all together in the same room. That's maybe where they've decided to discuss it. But their expertise in the areas that you've outlined is terrific. And I think everything they can do has shown that they know how to drive down costs, whether it's, Warren with Geico Insurance, whether it's Amazon with Amazon Prime and the spending, and with Jamie at the banks. What we're seeing is they know how to lower costs, lower expenses, much better than government ever has done, probably in the history of this country. So I'm very supportive of what they're trying to do.
Senator Barrasso, Dr. Barrasso, just kind of running through, we don't have many details at this point, but if you were trying to figure out how to cut costs out of healthcare, if you were in the private sector and you were doing it, how would you suggest doing it? Because we're trying to figure out what this means for insurance companies, what it means for the pharmacy benefit managers. Where would you expect to see costs get squeezed a little bit?
Yeah, well, you could firstly focus a lot on wellness. I've done a program in Wyoming, the Wyoming Health Fairs, low-cost blood screenings, finding problems early, getting early treatment for problems before they get worse. And I think they can do a lot more with that. And the government has failed with that, but private companies have been able to do that. And that's the first place I would do, getting people more invested, more involved, more educated about their own health, which will help lower their cost. And certainly fitness is part of it. As you know, you see obesity is the new smoking. We've done a lot to get rid of smoking in this country. We need to focus on people's overall fitness level. Obesity is such a major contributor to the healthcare costs in terms of pain medicines for arthritis, in terms of heart disease, high blood pressure, diabetes. So much of these things can be dealt with diet and exercise. And from a corporate standpoint, I think they're going to be able to do that much better with their employees.